Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. Hey, what's going on? Dr. Chris here. Today I want to talk about low back pain and some common myths that I want to kind of bust. First, let's start off with imaging. Do you need imaging for low back pain? In short, no. Usually, no. You do an evaluation and we can almost always figure out what's going on. Imaging can be a little misleading, and you don't want to have confirmation bias where you have an image of a bulge or something like that, and then you assume that's what the problem is, and maybe the therapist or chiro or whoever's evaluating is also linking that to the image. And oftentimes people will set up an evaluation with me, and they want to send me their imaging first. And I said, no, let's wait. Let me evaluate it first, and then we'll correlate if your back pain symptoms are related to the imaging, because sometimes they are and sometimes they aren't. I often will tell people the best way to get surgery for your back is to get an image, right? Because now you have what in your mind is a known pathology that you need to cut out, and that may not be the case. The truth is if you're over 20 and you take an image of your back, you're going to find some stuff. This just part of what happens to the spine or your whole body. Things change as we age. That's normal. I can't tell you how many times I've seen somebody who has low back pain, and then they go get an image. They find a bulge, L4, L5, something like that. By the way, L4 and L5 is a natural hinge of the body, just as the way we're shaped. So most pathology does start from that region, but you can have a bulge there, right? And then you have back pain, and then maybe you get surgery to correct it, and nothing changes because the whole time was just an irritated muscle. I've seen that a number of times. In fact, there was this study that came out in 2015. They looked at over 1,200 people between the ages of 20 and 70. And this is all asymptomatic people, by the way. 87% of people between the ages of 20 and 70 have a disc bulge and don't have symptoms. In a different article that came out in 2015 as well, they looked at disc degeneration. They looked at this is actually a systematic review looking at over 3,000 articles. So 37% of 20-year-olds with disc degeneration on imaging were also asymptomatic. And in the 80-year-old age range, 96% of people have disc degeneration and don't have symptoms. I touched on surgery too. That's another thing that I think people rush off to do too soon, and that's another thing I see a lot is people, they tell me they've got back pain, they're going to get the surgery first and then do physical therapy. I'm like, well, why wouldn't you do it the opposite way first? Be conservative first before you cut yourself open. If rehab doesn't work and maybe you tried some other options and you've got imaging at this point, because that's maybe when it becomes a little more relevant to get imaging, then maybe surgery is an option. But do all the conservative stuff first. So, back pain with seen pathology on an image does not necessarily mean surgery. Oftentimes it doesn't. Even like a disc. Discs heal, I forget the number, I think it's something like 80% of the time, 87% of the time, a herniated disc will heal on its own. Alright, so next on the list is that low back pain is for older people. Not true. In fact, one group of people that tends to get a lot of back pain is young gymnasts. Young female gymnasts tend to get a ton of back pain. Also, it's more common in the 30 to 50-year-old age range. And there's reasons for this. Because as I mentioned earlier, the spine changes as we age. So when you're young and perfect, the way the anatomy works is you got a vertebrae, a healthy disc, another vertebrae, and the space between them creates a hole for the nerves to exit. That hole is called a foramen. And you've got these facet joints that are sort of the backside of the vertebrae, which line up and kind of sort of limit motion to an extent, but they also can get irritated with time. So one of the things that happens as we age, the discs tend to narrow, aka disc degeneration, but that's a normal process of gravity having its effect on your spine and the disc dehydrating with time. So then the vertebrae sit a little closer together, and that kind of narrows that foramen, and that's what we call stenosis. And this usually happens between that 30 to 50-year-old age range. Also, the ligaments that go vertebrae to vertebrae are now sitting a little closer together, so they have a little slack. So you kind of get this combination of a little bit of stenosis and a little bit of instability at the spine. Then as we get older, what happens next is the vertebrae actually change shape. They become a little more wedge-shaped, which creates a little more space in that foramen, so it kind of reduces the stenosis. You got some fibrotic changes to the disc, so they kind of stiffen a bit, and same with the ligaments, they tend to stiffen. So actually, when you're out of that 50-year-old age range, you have more of a stability situation with your spine, which is good. That will tend to lead to some stiffness. You'll lose some range of motion, but that's sort of the normal process of the spine. So this is all normal. So pain is a normal human experience. In fact, 80 to 90% of adults will experience back pain at some point in their life. Remember, pain is not necessarily a bad thing. It's your body's diagnostic system. It tells you where there is an issue, and it tells you what to do and what not to do, right? So if a certain motion bothers you, it produces a pain signal in that area to get you to not do whatever motion is provoking it. That's all it really is. It's information. All right, another myth I want to talk about is weight loss. So a lot of practitioners will say, well, you just got to lose weight. Losing weight is going to help the pain. Not true. You can be obese and have no back pain, and you can be skinny and have back pain. You can have scoliosis and have no back pain. You can have a perfectly straight spine and have a lot of pain. So those things are not necessarily correlated. Now, I would say that if you're morbidly obese, there's other issues that may be playing a role. Like if you're morbidly obese, you're probably having a metabolic issue. And when you have a metabolic situation, your body will start to lay fat tissue into muscle. So if you see the word fatty infiltrates on an MRI, that's a sign that you have a metabolic problem. And then the low back muscles get weak. So there is this sort of weak link there, but it's not just like this belly is just pulling your spine and that's what's going to solve your issues. The evidence just doesn't line up with that at all. All right, next on my list, I'm bringing off a little checklist here so I don't forget anything. Deadlifting is bad for your back. Also not true. If you come to me for back pain, you're going to probably end up deadlifting at some point. Now, it may be the case if you hurt yourself while deadlifting that you might have to lay off deadlifts for a bit and work on some motor control. There's probably something you're doing a little funky in your deadlift. And the most common thing I see is people kind of squeezing their glutes at the top and kind of hyperextending. That's just creating irritation at the spine, right? So this is a bit like especially if you do a load and do a lot of repetition. It's kind of like hitting your thumbnail with a hammer lightly. You do that for long enough with lots of repetition, it's going to eventually start to hurt. Just like Chinese water torture. You drop some water on someone's forehead, it's not going to hurt. You do it 10,000 times, that's going to eventually start to hurt. Trust me, I have a little brother. So deadlifting is a fantastic exercise for the back. So usually if someone comes to me and they're having some pain with extension, pain with deadlifting, we're going to work for a while to desensitize things, all right? And then we're going to strengthen the muscles that line the spine, and then eventually get to those bigger muscles and work on motor control and how to deadlift without hyperextension. Which brings me to another point about form. So it used to be it's all about the form. And now the pendulum, at least according to Instagram, has swung the other way, and people say, oh, form doesn't matter at all. Well, like always, the answer is usually somewhere in the middle. So I like to say form only matters if it matters. So if you're doing deadlifts, for example, and maybe you are hyperextending a lot, and it's not producing pain, you might be able to get away with it, maybe for a while. But until it starts to matter, until you start to get some pain, then you're going to have to concentrate on form. But I think, why not start off with good form from the get-go and just avoid it altogether? Okay, and the last myth I want to kind of bust is that tight hamstrings are causing back pain, and stretching your hamstrings will fix it. Very rarely is that a case. I don't think I've ever seen stretching hamstrings to reduce back pain. That's a little bit of a circular logic type of thing. What will often happen, and by the way, I usually tell people to stop stretching their hamstrings when they're in back pain, and I'll explain that in a second. So what people will often notice is their hamstrings stiffen when they get back pain, and that's because of the nerve. So if you picture your nervous system is all one set of cables, starting from your brain, going into your spinal cord, through all the peripheral nerves, including the sciatic nerve, that if you were in that like L-shaped position, so like bending over to stretch your hamstrings, like an L-type position, that puts maximum tension through the nervous system. If your nerve is involved in your back pain, which it almost always is, that's just going to irritate the nerve further. So what the hamstrings will do is they'll sort of protectively stiffen so that you don't overstretch the nerve, because nerves are not stretchy like muscle. It's like a cable. And if you stretch them, they get really irritated. So your body is responding to protect the nervous system. So stretching the hamstring oftentimes will make it worse. That's not to say to never stretch. It's just that when you're in that irritated state, you may have to temporarily lay off stretching the nervous system, the hamstrings. All right, so to summarize all this, low back pain is almost inevitable as a human. You're going to experience. Your spine changes. It's normal. You're going to get better. I'll say that the people that tend to experience it more often are the ones, it's kind of a spectrum. Either they're doing too much or too little. So your couch potatoes that don't do anything and they just want to protect their back and are afraid of pain. Once they have to do something strenuous, like lift some heavy luggage overhead in the airplane, then they sort of quickly have exceeded their tissue capacity because their tissue capacity is pretty low. They'll tend to get a lot of back pain. And then those that just do a lot, so your workout type A person who's just in the gym constantly, well, they're constantly pushing their body to it's basically end range. They're constantly testing their limits, so they're going to find pain, that's fine. That's a normal part of the experience. So if you get some back pain, don't freak out. It's just information. It's your body telling you you've done too much, too little, whatever, and you just course correct from there. A ship in harbor is safe, but that's not what ships are meant to do. What does this mean? It means exposing yourself to difficult situations so you become resilient. If you need help building resilience, check out our flagship program called Physiologic Flexibility. This is a 3-month do-it-yourself program that teaches you how to maximize your homeostatic regulators, such as your pH, blood glucose, O2 and CO2 tolerance, and temperature. We give you specific action items through the program with the goal of becoming anti-fragile. If you want to become the inspiration for your friends and family, this is the program for you.